Hi, today we're going to learn about the issue of do consumers really have the information they need to make informed decisions, and do they know how to understand and use that information effectively? We're going to be hearing about it from one of the world's experts, and certainly Israel's expert on this issue, Professor Diane Levin-Zamir. Welcome, Diane.
Thank you. I'm very happy to be here and thanks for the invitation.
Good. So you've done so many exciting things in your career. Tell our viewers a bit about that.
Well, I can just say that my profession is health promotion. I did my bachelor's degree in community health and medical anthropology at Tufts University many years ago, after which I moved to Israel, where I did my MPH and a doctorate at Hebrew University, the School of Public Health, and now I'm a full professor of public health at School of Public Health in University of Haifa, and also teach at the University of Tel Aviv. But my practical experience is for decades directing the Department of Health Education and Promotion for Clalit Health Services, which is Israel's largest health service organization, which I did up until just a few months ago. I'm the chair of Israel's policy, uh, the National Policy Council for Health Promotion. And I also am a research co-chair of the MPOL network for WHO in the European region, which is measuring organizational and population health literacy in 28 countries. I established the Global Working Group in Health Literacy of the International Union of Health Education and Promotion in 2010. And then also I just am an associate editor of Global Health Promotion Journal. So try to stay active and involved in many fronts.
Terrific, terrific. So what is health literacy?
Well, thanks for the question. Health literacy is really what we look at as a very important part of health promotion and quality and patient safety and clinical outcomes. But specifically, it represents personal competencies and organizational structures, which we'll go into hopefully in a couple of minutes, and which enable people to access, to understand, to appraise and use information for their health, for the health of those who they are responsible for, to help make better decisions. So it's really an important tool for all of us to be able to promote our health and for self-care throughout the entire life course.
Well, that's super important. So how is health literacy in Israel and how does it compare with other countries?
Okay, well, what we have done is that as part of this network, the NPOL network, which I mentioned, we've measured health literacy. We have a measure that is has been validated and been published. And we don't like to compare ourselves to other countries, but if we do, if we look at how they're doing and we're doing, we can see that we have about 30% of our population struggling. According to our measure, at least that amount, which people who are expressing the need to be able to have more support, to understand information, to access it, and also to be able to appraise, which is really interesting because we know that there's an amazing infodemic for health, particularly since COVID. And people are asking, can we trust this information? Is this information been published for my health? How do I know what the sources are? How do I know the sources are authorities? So that is a whole new aspect. So right now, when we look at health literacy, we look at the functional aspects of people being able to deal with information and understand it. We look at interactive health literacy, which means, can we ask questions? Who do we ask questions? Do we feel comfortable asking questions and expressing our needs? And finally, critical health literacy, which really, as I mentioned, is the skill to be able to appraise and look critically at the health resources that are available to us and access them in a way in which we are understanding that it's for our benefit. And if not, to know when not to use the information that we're seeing. So it really has many facets right now. We're looking
So,
at
so,
digital
so
health literacy, navigational health literacy, communicative health literacy. There's even vaccination health literacy. So
wow,
it's been really branching out and going forward into many different aspects. But
wow.
we still look at it in general.
So how does Israel compare with other countries?
I think we're really doing a very good job in understanding that there's needs and taking as much as we can, which of course we can always do more, go forward. One of the important and interesting parts of Israel is that about looking at this topic through the prism that the Israeli experience is that Israel is a country of cultures, and we know that. So one of the really interesting, and I think we can be proud of, investments that Israel has is really looking at the cultural appropriateness and cultural sensitivity that's needed to be able to promote health literacy and also to make sure that we're being appropriate to different levels of health literacy. For example, a directive of the Ministry of Health from 2011, from the year 2011, which requires the entire healthcare system to make sure that they are doing what is needed to be sensitive to cultural needs for health information and the healthcare system in general. And that's looking at helping people access information that is culturally accepted, that is language appropriate. It's also looking at what we need to be put in the communities. For example, Israel has a very, very special program of cultural liaisons in primary healthcare clinics coming from the Ethiopian population to help Ethiopian immigrants navigate the healthcare system, understand the way in which their healthcare team is recommending the different health and medical recommendations and help them express their needs to their healthcare team. This is a very, very unique program, and we're very proud of it. So this is just a few examples, but it
But
is according to regulation. We are required to do it, and the healthcare system is also audited for it. So this is just a policy example of how health literacy it plays into practice in Israel. For one
okay.
example.
Okay, I'm sure that there are many, many different things that could be done to make things even better, and one needs an integrated approach, but we only have another minute left. Can you give one concrete example of if you could have one more thing happen
Well,
in Israel?
I'm going to take two.
Okay.
Israel's a startup nation, as we know, and Israel's doing a lot of work on digital health literacy. We've also measured it in Israel. We see where the needs are. The needs are for those who may be more financially deprived. We're looking at equity. We're also looking at the way in which we can have older people access digital health resources, which we have a lot of in Israel. So we need to do some more intervention to be able to close gaps for digital health literacy and also look at a whole systems approach. There are countries, and we hope to be one of the next countries that has a national action plan on health literacy so that we can look at it on all levels and research, policy, practice, and make sure that we're doing the best job so that people's rights to have the best information to take care of themselves and their families are absolutely in place.
This has been great, Diane, and I know that you're very open to conversations and input from people from other countries. You're one of the key people in this broad international network, and I expect that quite a few of our viewers will reach out to you to learn more, to maybe give their ideas. So thank you very, very much.
Thank you, and I welcome any contact that people want to make and to keep the conversation going. Thank you so much, Bruce, for inviting me.